Hello everyone. I hope you all are good. Today I would like to share some of the concept and some of the cases of autonomy. So, as you all know, what is autonomy? But just for the reference, autonomy is where the patient can choose their own decision, choose their own judgment for their own treatment. So let's start with that. Autonomy is very crucial, obviously, for the patient as well as for the healthcare provider. For both, it is very important. So it helps the patient to be more comfortable with their healthcare provider, and also the healthcare provider can understand what is the patient's point of view, and also can consider the opinion of their patients. It is very important to respect their decision, whatever they take regarding to their treatment. But okay, let's start with the case 1. So the case 1 was the 16-year-old boy have to refuse his blood specimen. So over here in the boy's situation, the parents were separated, and so they both have their own decision. Both the parent have their own decision. So one parent was wishes to draw the specimen, and the another parent was with the boy's decision that he doesn't want to draw it. So I think in this kind of situation it is important to also consider what the boy wants. I know that the age of the boy is still very small, but I think it is important that but it's 16-year-old. It is important that what the boy wants. Parents should give them advice to the boy about the treatment and also about the decision, but the healthcare provider should also let the boy know, or the patient know, about what will be the consequences and the risk through that treatment, or either they should at least let them know that what the problems or any other risk that the boy might get after doing that surgery or not doing that surgery. So that is very important in the case of autonomy. I think, yes, and also, like, obviously healthcare workers are working very hard to and they respect the patient's point of view. They respect the opinion of their patient, but it is also important to let them know what the risks and the consequences they might have to fight with that. The another case was of the Mrs. V's case. So over here, she was Mrs. V gave the birth to the healthy baby, and so she endured heavy blood loss due to placenta residues, and so her husband do not want to go through the surgery, but healthcare provider already mentioned that if they didn't did the surgery, then they might have to then there are chances of the death of Mrs. V. So it is so I think in this kind of situation it is very hard because over here the limitation that comes here is the religious concept. So according to their cultural or the religious thing belief, sorry, um I think they don't want to continue with the surgery. So it is important to also make sure that the patients, you are also keeping in mind that the patient's cultural and religious practice is believing that, so the healthcare provider cannot do the surgery. So and also, like, as we all know that so as you all know, because already the healthcare the doctor mentioned that the death can proceed for Mrs. V, but if they do the surgery, there are more chances to have the successful surgery, and also they will come out of come out of their situation. So I think over here it is physicians are the best advisors for sure, who can advise the best thing, the best risks, the consequences, the problems that they're gonna fight with, that can proceed to death or any this kind of situation. It is important to get help or advice from the doctors or the healthcare provider, and choosing the right doctor, it is very, very important. Right doctor in this sense is provide the good good treatment with their good advice. Also make sure that the doctor is keeping keeping in mind the patient's point of view and the opinion, and it should respect the opinion. So it is important. And some of the benefits of the autonomy that I would like to mention is, like, for sure it endures patients to be more comfortable with the healthcare provider, and also to make the appropriate decision for their treatment. And also I would like to mention some of the limitations that can affect the autonomy, that are, I think, age or any kind of socio-economic status or personality or minors, that might get some of the limitations on the patient's point of view. And also I would like to mention that at the last, it is important to keep in mind about the concept of autonomy before getting it to the actual decision. All thing have pros and cons, obvious. So in autonomy also, there are pros and there might be some cons as well. Autonomy is important so that patient can actively involve in the treatment, in the decision that they make. And yeah, that's all I want to share. I hope you liked it and you have a very good day. Bye.